this week, the province reached above 2 million mark in terms of the number of inoculated persons. We have, as the province, a target of vaccinating a total of 7.5 million people if we are to contribute meaningfully to the country achieving population immunity for the COVID-19 virus. Our target is to reach 60,000 daily vaccination, which could help us reach our target by the end of March next year. This will allow us to firmly focus on the task of rebuilding the economy and saving jobs. We are very encouraged by the positive response that have been seen and shown by young people aged from 18 onward who have came forward to get vaccinated since they became eligible for this a few days ago. We share this sentiment that have been expressed by academics elsewhere that the vaccination of the over 18 cohort is good for us in a number of ways. Firstly, it means that all adults with comorbidities are now eligible for vaccination. Secondly, as a relative young country, the over 18 population group is quite sizable and influential. It is therefore, it has power to change the narrative around vaccination and make it positive. This is especially so because of their access to social media, which is one of the places that shape people's opinions and their general outlook. So indeed, we are pleased that the over 18s are now coming out in their numbers and sharing their selfies and posting videos of themselves getting vaccinated. May this period continue because it has a number of these positive spin-offs. This also means that these youngsters will be safe from the virus, but also they will pose less of a threat to their parents and grandparents and other members of their household who might be of advantage age or be living with comorbidities. We have so far registered 216,754 aged between 18 and 34 and have vaccinated 55,302 of them from the 20th to the 27th of August. This gives us an average of 7,000 vaccination amongst this group per day. When we do a comparison between the waves that we have had, we realize that the highest number that we recorded in a day during the second wave was 6,700, while during the third wave, the highest number has so far been 4,198. We remain concerned that our numbers are on the upward trend, while the difference this time around is that children, mostly learners, are also getting infected. The overall percentage change in the number of new cases between week 33 and week 34 was 33%. The actual number of new cases recorded was 15,333 for week 33 and 22,817 for week 34 respectively. This increase in the number of new cases was noted across the province. Within the last 24 hours, which is our reporting cycle, we have had 3,107 new infections, bringing the total number of confirmed cases to 474,026. We currently have 59,274 active cases and have sadly lost 13,433 people, and we pray that their soul must rest in peace. There have been 400,455 recoveries. The number of daily hospital admissions has also increased in both private and public hospitals. Over the past week, 2,648 people were admitted in public and private hospitals. The upsurge in cases has moved from Mutugela, Amajuba, and Umzinyathi. Currently, the districts that are recording a high number of cases daily are eThekwini, Umgungundlovu, King Cetshwayo, Zululand, Umkhanyakude, and Ilembe. These districts have for the past 3 weeks had continuous high number, with eThekwini accounting for more than 40% of cases a day. Now, the province has had more than 1,100 COVID-19 cases in 350 schools in the past 3 weeks. These numbers are increasing daily, and more learners are testing positive. Sadly, the pandemic has claimed the lives of two 12-year-old children as well as a 9-year-old. And we're emphasizing this point to indicate the age of the people who are now infected, who are getting infected, and sadly, some are passing on. The Department of Education is intensifying non-pharmaceutical interventions to reduce the spread of the virus in schools. Clusters have also been observed in other congregant settings, such as boarding schools, mental health facilities, centers for visual impaired, and old age homes. We urge those who are requiring assistance where there are clusters to contact the National Institute for Communicable Disease on their toll-free number, which is 0800 029 999. In terms of intensifying vaccination effort, we would want to emphasize that in order to defeat COVID-19, vaccination is the obvious key and most important intervention to save lives. Of course, this must be done in conjunction with non-pharmaceutical prevention measures such as wearing of masks, regular hand washing or hand sanitization, as well as social distancing. We've begun taking a closer look at whether the people who get vaccinated at our facilities, on whether people who get admitted at our facilities were indeed vaccinated, so that we can establish scientifically how many of them recover and how many eventually lost their life. Looking at admissions between the period of the 16th of February to the 14th of August, we have had 13,119 hospital admissions. And in terms of these admissions, it concerns us that of the total admissions for this period, only 3% or 384 were vaccinated, while 57 or 7,523 had unknown vaccination status, and 40% had not been vaccinated, and that 40% is 5,212. while more data is being collected and more detailed analysis is still being conducted, which will provide scientific and medical explanation to this, at face value, it does appear that the majority of people in hospital and those who sadly passed away were not vaccinated. We have also observed that the majority of vaccinated people face mild symptoms and were quickly discharged from hospitals. It does appear from these preliminary observations that if you are vaccinated, you stand a better chance of fighting successfully against COVID-19. On the issue of deaths at home, as the province were concerned by the 227 confirmed cases of COVID-19 people who have died at home, though this number could be much higher. This is because of the high number of people who are dying at home, but their mortal remains do not get tested before they are buried. We are therefore once again urging families to allow or request funeral parlors to test these human remains for COVID. This is a service that the department assumes greater significance in our province in the light of the recent civil unrest, which led to death and disruption of business. This period presents us with an opportunity to introspect and reflect about the lives that we lead, and about our past as well as about the future that we want to create and leave behind for our children and future generations. It is also an opportunity for us to heal from the deep scars of our painful past and associate injustice and hate, and to tolerate and accept each other in order to forge a future of unity and togetherness. As government, we will use Heritage Month to contribute to the rebuilding of the province's moral core and to help grow a society that is united in its diversity. We have resolved to host a hashtag We Are One festival, which will be held in compliance with all COVID-19 protocols. This occasion, whose details will be communicated in due course, will be utilized to unite and promote social cohesion across the different cultures. Government hereby invites the people of the province of KwaZulu-Natal to also use Heritage Month to engage in dialogues and programs to focus on youth and women empowerment, teenage pregnancy and HIV, drugs and substance abuse, and the whole issue of the gender-based violence. As we conclude, we wish to indicate that this week we will intensify our vaccination program with partnerships between government, business, faith-based organizations, traditional leaders, media, creative industry, and institutions of higher learning. We will from this week launch a series of vaccine pop-up sites and ward-based vaccination drives. We are concerned about the two emerging strands between vaccinated and unvaccinated people. We note that the vaccinated people now want to have more access to sport, entertainment, and hospitality. We are also mindful that we still need to get everyone vaccinated. We would want to clarify to those who are still vaccine hesitant that vaccination is the first step to getting our lives back to normal. Vaccines are safe, and this has been confirmed by all regulatory and scientific bodies. Those who get vaccinated may suffer mild symptoms, which may include headache, fever, fatigue, muscle pain, or a runny stomach, which simply implies that the body is building resistance against COVID-19. These can be managed through rest and medication prescribed by doctors. In instances where any side effects are not subsiding, we recommend that patients present themselves at their nearest healthcare facility without waiting for too long until complications set in. Let us all vaccinate and be remembered as the generation that helped create a COVID-19 free KwaZulu-Natal and South Africa. With that, we wish to thank you all, and we call on all of us to be the ambassadors for this vaccination drive. Thank you.
Thank you very much, Now we'll move straight to questions of clarity. The colleagues, if there is an online question, please give us an indication. I will start in this house by show of hands. Do I see any hands? My lady on the other side, followed by my usual suspect, first corner. Is there any other hands, guys? Okay, go ahead in that order, please. Please introduce yourself and the mayor house. Yeah.
Good afternoon, Premier and NBC. I have two questions. The first one is whether...
Okay, you are?
Oh, sorry. Let me introduce myself. My name is Kali Lebengu, and I'm from the Newzroom newspaper. My first question is whether, similar to other provincial drives for vaccination, will the Premier and NEC be visiting not only your own facilities, but also the private facilities, so that the public can see that they are endorsed by the provincial department? Because that seems to be a lacking profile for the other vaccination centers, because we do see that there are private facilities vaccinating. And then my second question is whether the NEC has any comment on the negative sentiment by opposition parties on how the Premier has responded to the NEC's alleged super spreader party.
Okay.
I think I'm the cabinet party. Premier Kosikona Doma from Newzroom Afrika. Premier, there is a sense when it's currently not clear whether or not the local government elections are going to take place, but it appears that political parties are currently ramping up efforts, trying to amplify or rather implement their campaign processes if we indeed proceed with the local government elections in October. I'm just wondering, from government's perspective, we know that the election period can get quite, gruesome, and they can really activate some security threats. Are public institutions ready? Specifically, is law enforcement ready? Is there a program of action that the provincial government is already thinking ahead, given the province's history with violence when it comes to politics, or is everything just left resting on the court's decision on the local government elections?
Okay. So let us go with the you colleague.
Yes, someone Talisokova from the Witness newspaper. I just want the last time we were here a couple of weeks ago, schools were a big issue, and I think the Premier just said that pre-learners have died so far. I think we have seen some sort of protest from parents, some parents holding stayaways, not sending their children to school. So I just want to know, have you been talking sort of to maybe parents or people, organizations, representing parents, and just what is what is the situation?
Let's use this point in the Q&A session, rather poor sound at the moment, to take a quick breather and go back there so we can catch their responses.
Good afternoon, ladies and gentlemen. Colin, I'll start with your last question. I will not comment on the approach of the opposition parties, particularly because the DA, represented by Zwagele Mngau, have indicated that they programs that are aimed to encourage people to come and vaccinate. And some of those programs are your drive-through programs that we have. We started in King Keshwai. We're now implementing it in eThekwini, and we'll be moving to Umgungundlovu and in all the urban sites, because we believe that is a very innovative program, and people actually are quite excited to get that. We also have a program where we are vaccinating people in taxi ranks, because you also don't want to be seen as the department or as government to be preferring one sector over the other. So we've decided that we must be able to actually take care of everyone. So indeed, we are going to those sites, and we started in eThekwini and we'll be moving out throughout the province. And a majority of those sites we are actually managing together with the private partners. It's not just the Department of Health that are managing those. I'm giving you these programs because I want to indicate that, yes, there are sites that we are managing on our own, but there are also sites that are managed together with the private partners that will include either your NGOs or companies. In fact, we are running a program with SPA, in partnership with SPA, where they decided that they want to vaccinate all their health workers, and we came into a memorandum of agreement. And one of the conditions, or our request, Premier, maybe not a condition, our request was that while we support them in vaccinating their own workers, can they also expand to the nearest workers in the place where they are at? And they agreed, and it's a very nice partnership. So we do have a lot of partnership or programs that we are running with private sectors. Where you might not necessarily be able to see us is where there are chain superstores or chain organizations that are running those. Not necessarily because we are not supporting them, but it's because we often are aware that they are running them quite smoothly. The Department of Health, led by the head of department and Mrs. Msimang, who's the DDG responsible for vaccination, any private vaccination site, before it's instituted, they engage with whichever partner or whichever private owner is establishing that, and everything else is dealt with within the Department of Health. But yes, where you have mass vaccination sites that are managed by your private sector, we certainly are going to be part of those, and we'll be visiting. I'm explaining this because I want you to understand that any vaccination site, right from the beginning, government is involved. It's just that it depends on the nature of it, how big is it, and then you might not necessarily see us visiting there because the admin has been done up front. The last question from Mutabiso was whether the Department of Health and Education have engaged the parents in terms of the worry. I think we must also indicate our worry as government, and I think the Premier emphasized that when he started, to say we began seeing clusters earlier on in the month, and we are seeing them increasing, and that for us is a serious worry. But as the Department of Health, despite the fact that initially the scientists gave an indication that COVID-19 does not affect young people as adversely as as the older generation, but what we are seeing in other areas is actually the opposite of that, hence the fatalities that have been reported. So we've also requested our scientists to go back and actually do a proper research and come back and inform us on what actually is happening, what could be the cause. You might find that some of these young people, when they pass on, they might have, or when they contracted COVID-19, they might have had comorbidities. But that is something we can't just assume. we actually have to do a proper research and be able to explain and get a report. So we are working on that. We have requested our scientists to do that. In the meantime, the Department of Education and ourselves are working on a strategy to try and talk to the different stakeholders. If you remember when COVID-19 started, one of the big stakeholders that we engaged on were stakeholders from the Department of Education, because there were quite a few children that were involved. So we met with educators, we met with principals, we also met with the parent unions, and it's something that we are looking on how we're going to implement it moving forward, because you are correct. We do need to engage with them. We do need to allay their fears and address some of the issues or where they have concerns. But you also don't want to give parents information that is incorrect or information that is half-baked. So we are working towards that. I think I've responded, Mr. Babaso, to the questions that have been asked.